A 2-year-old child has died in the state of Texas from measles as the outbreak is growing here. The Secretary of Health and Human Services has downplayed this crisis by saying that we have measles outbreaks every year, which is false. We do not have measles outbreaks every year. According to reporting from the Associated Press, measles outbreaks are only sporadic and was declared eliminated in the United States back in 2000, with only small re-emerging situations among unvaccinated communities. But as we have a health secretary who is downplaying this crisis, it's only getting worse. But sure, we should just get rid of the CDC's campaign on getting your flu shot amid the worst flu season in the United States right now.
After flu season, tonight new CDC data showing an increasingly deadly toll, with now 19,000 deaths from the flu overall this season and 18 pediatric deaths reported just last week. While test positivity rates fell slightly, the vast majority of states reporting high or very high flu levels.
Definitely the most intense flu season in my career.
At Chicago's Rush University Medical Center, Dr. Nicholas Cozy says kids infected with the flu are getting secondary pneumonia infections, a combo typically reserved for older patients.
Kids are coming in with difficulty breathing. They're not able to drink. They're not able to eat. It's making their heart rate elevated.
12-year-old Taylor McGinnis flew from New York to Arizona for a soccer tournament only to get sick for a week.
It felt like I just was very tired and couldn't really move very much.
Meanwhile, chaos rocking federal health agencies, with the CDC's Wild to Mild campaign promoting flu vaccines appearing to have been wiped from the agency's site. It comes roughly a week after famous vaccine skeptic RFK Jr. was sworn in as Health and Human Services Secretary. HHS not responding to NBC's request for comment on the campaign.
That was reporting from NBC News. Another infectious disease we've been following closely here on the Jeremiah Patterson Show is tuberculosis. As you know, Kansas right now has the worst tuberculosis outbreak in the history of the United States since the CDC was founded and first started investigating it back in the early 1950s. As of today, there is reporting of a tuberculosis case in Hartsville, South Carolina. According to reportings from WBTV, an investigation has been opened into a small group of people outside of the school related to transportation needing to be tested as well. Parents in South Carolina in the state received this letter. It says here essentially that tomorrow your child will receive a letter to bring home to you, whether or not essentially that your child needs to get tested. Please ask your child for this letter, as this letter contains additional details regarding this investigation. It is safe for students, faculty, and visitors to be inside of the school. The tuberculosis germ can only be spread by person with tuberculosis disease by sharing airspace in a confined area for a prolonged period of time. You can only get infected by breathing in tuberculosis germs and not by touching surfaces. Symptoms of tuberculosis include a prolonged cough that produces sputum or phlegm, unexplained weight loss, and night sweats or fevers. All of these symptoms go together and should not be confused with normal cold or respiratory illness such as COVID, flu, or RSV. So we will keep you updated on that situation as we learn more. Regarding bird flu, though, which is an emerging crisis here in the United States, 2 dead geese in New Jersey have tested positive for bird flu as officials have posted this, urging public to essentially avoid contact with all birds. This is the sign. Avoid direct contact with birds. Do not feed, touch, or remove birds from the park. Walk cautiously where birds gather to avoid bird poop. If you encounter a sick or dead bird, they literally say here, call the New Jersey Department of Environmental Protections. Call the DEP hotline if you come in contact with a sick or dead bird. In Arizona right now, Nevada, cows have been found to have bird flu. Of course, this comes after a virologist told The Guardian recently, as we did reporting here on the Jeremiah Patterson Show about this, that the bird flu is now endemic in cows, meaning that it cannot be contained. In Texas, a bird flu was confirmed, a dead bird was confirmed positive for bird flu. This is Texas public health officials warning to the public. Do not touch sick or dead animals or their droppings, and do not bring sick wild animals into your home. Keep your pets away from sick or dead animals and their feces. Avoid uncooked food products such as unpasteurized raw milk or cheeses. If you experience illness after contact with sick or dead birds, please contact your healthcare provider for evaluation. In Philadelphia, more than 1,000 cases of bird flu have been confirmed at a live bird market. Earlier this week, Evan Berg at KMT reported here that Minnesota's Department of Agriculture launched a new pilot program to begin testing unpasteurized milk for bird flu. Dr. Hemant Nakari, director of the University of Minnesota's Veterinary Diagnostic Lab, said its facilities in Wilmer and St. Paul that will begin testing for around 1,600 samples from farms in Minnesota. The initial pilot program is set to test once a month for the next 4 months, and if it's approved for further use, it will eventually run all year round. Quote, a little extra work definitely for the Department of Agriculture, but for the product's point of view, it will just be an extra bit of sample that the state will begin testing. We're going to have more extensive reporting on bird flu essentially here as all of the other infectious diseases are rising in the United States. We're going to have more reporting on that on our upcoming weekend shows as this is becoming an emerging crisis. But I do want to just leave you with this last thing here. Check out this headline from Reuters here. The United States will spend up to $1 billion to combat bird flu, USDA secretary says. How are we going to do that exactly? Well, they plan to import eggs from Turkey because, of course, the prices of eggs are rising here exponentially in the United States. So they're going to import eggs from Turkey, and Turkey has agreed to import eggs into the United States, effectively. And they're also going to have $500 million set aside, which will be provided for biosecurity audits to firms, and $400 million set aside to increase payments, essentially payment rates to farmers who need to kill their chickens due to bird flu. So essentially it's compensation. Sorry you had to kill your chickens due to bird flu. Here is money from the USDA. The problem with this is, the concerning part in effect, is that funding from the USDA has been cut by, drumroll please, Elon Musk. Elon Musk's Doge has gone into the Department of Agriculture and effectively cut funding. So now they're going to have to borrow up to $1 billion to fight bird flu from their discretionary funds provided by USDA's Commodity Credit Corporation. So yeah, thanks Elon. While we're trying to fight off a major bird flu epidemic, now is a great time to cut funding from the agency that's tasked with investigating and actually trying to stop this thing. I mean, it's not like Secretary Rowlands didn't know this was happening, or it's not like she locked the door, she let Elon in. So, I mean... Also, remember how they fired the scientists as well and then had to bring them back, or tried to bring them back because, oh wait, you guys are investigating bird flu? Incompetence and malfeasance in government is one thing. It is particularly bad to have an incompetent and malfeasant government. But incompetence and malfeasance during a public health crisis is lethal. Especially during bird flu right now. I mean, look at the cases. This is the CDC's map of bird flu in the United States. And the incompetence and malfeasance is already starting. I mean, the Secretary of Health and Human Services, Robert F. Kennedy Jr., has just downplayed the passing of a 2-year-old child. Downplayed the passing of the measles outbreak in Texas. There is a lot going on right now in the government. I do understand that, yes. And yes, we have devoted significant attention to bird flu and infectious diseases rising in the United States. But that's because there is so much happening. The Trump administration wants you not to focus merely on just one thing. The goal is the art of distraction. But it's important here to watch what they are doing, watch their actions, and not just what they're saying. But also not to just be so laser focused on one specific action that they're doing, but be specifically focused on everything that they're doing at all. Pick several things. USAID, for example. Pick that. Look into what they're doing with USAID. We're going to be having extensive reporting on the Jeremiah Patterson Show this upcoming weekend on our weekend shows about how you can stay more focused about everything that's going on amid what the Trump administration is doing. There is a lot going on in the government right now. Yes, I do understand that. We just did reporting on what Republicans have just did with the major tax cut bill to rich in this country. But devote particular attention to this, because this is about you. This is about your public health. This is about your body. This is about your family's body. This is about your kids and whether they can drink milk, whether they can consume eggs. Devote particular attention to this, because it is not hyperbolic to say that they are trying to kill us. Because in effect, when you have incompetent and malfeasant leadership during public health crises such as this, absolutely people are going to die. It was that incompetence and abdication of leadership that led to hundreds of thousands of people dying in the United States and millions of cases from the coronavirus because of Donald Trump's incompetence and malfeasance and his mendacity from the podium and the spreading of misinformation from the White House about what could actually cure you with the coronavirus. We have been through this before in terms of an incompetent administration dealing with a public health crisis. Because, of course, it is that mix, it is that conglomeration of stupidity, misinformation, and incompetence that leads and creates a dangerous conglomerate that leads to hundreds of thousands of people dying and bird flu becoming a pandemic and tuberculosis getting more serious and measles killing children. There is a literal anti-vaxxer as the Secretary of Health and Human Services right now. He's leading HHS, which, by the way, should I mention, is also includes the CDC. This is the same guy that says we should stop publishing reports from the MMWR. We should stop publishing infectious disease reports for 8 years. Let's put an 8-year pause on that. Right. Like, we're not facing a major public health crisis right now on multiple fronts, as the Trump administration is just gutting public health officials, getting rid of them amid this crucial time right now. Watch what they're doing, folks. Don't just be focused on the one thing that they're doing. That is the art of distraction. Their goal here essentially is to create one crisis, to get you to look at that, but then to create 150 more crises to get you to look at that as well. The goal here is to overwhelm you. It is to make you feel, oversaturated, overstimulated with the news. Follow here on the Jeremiah Patterson Show, because we are doing good work, good reporting to make sure that you're staying clear-eyed about what's happening here. And not many people are talking about bird flu, but it is becoming quite serious. And it is important to report and to catch these things early on, because this is exactly how it started with the coronavirus pandemic. Started small, Trump administration downplays it, grows bigger, Trump administration continues to downplay it, hundreds of thousands of people die. With the incompetence of this administration and the mass firing of public health officials, we are headed down that same direct path. And that is something to watch for. That is something to keep an eye on. And that is something that is worth and deserving of investigative, consistent reporting.